How to identify ECG changes in hypokalemia, potassium's role in EKG, and diuretic-induced hypokalemia. Hypokalemia can significantly affect ECG findings. Identifying these changes includes looking for ST depression, decreased or inverted T waves, increased amplitude of U waves, and prolongation of both the QT and PR intervals. Potassium is essential for cellular depolarization and repolarization, which the EKG measures. Diuretics exacerbate hypokalemia by promoting potassium loss in urine. Case scenario: the patient with weakness, fatigue, and ECG abnormalities. A 60-year-old patient with a history of diuretic use for hypertension presents with generalized weakness and fatigue. The ECG reveals ST depression and prominent U waves. Lab tests confirm hypokalemia. How to identify EKG changes? ST depression appears as a downward deflection between the QRS complex and T wave. T wave changes. Initially, decreased amplitude. As hypokalemia worsens, T waves may invert. Prominent U waves, visible after the T wave, may be mistaken for T waves, leading to a perceived prolonged QT interval. QT prolongation, best observed in leads 2, V5, and V6, should be corrected for heart rate, QTC. PR interval prolongation, widen space between the onset of the P wave and start of the QRS complex. Clinical pearls. Diuretics, particularly thiazides and loop diuretics, increase renal excretion of potassium, leading to hypokalemia and the associated ECG changes. Potassium is crucial for cellular membrane stability. Its deficiency alters depolarization and repolarization, leading to the observed ECG changes. Diagnostic measures. Serum potassium levels are essential for diagnosis. Continuous ECG monitoring is advisable given the arrhythmogenic potential. Management. Prompt potassium replacement is crucial to prevent malignant arrhythmias. Statistics. Hypokalemia is found in about 20% of hospitalized patients and is associated with a significant increase in mortality when severe. Source: Archives of Internal Medicine. Further reading. For a comprehensive understanding, consult ECG in Emergency Medicine and Acute Care, or the Archives of Internal Medicine.